All right, we are going to go ahead and get started. First of all, welcome to the Rethink Your Med Masterclass. Now, in this session, we're going to have about an hour together. And in this session, this is just an introduction. I hope to introduce you to some of the core principles behind how medications work. I am a firm believer that when you know the why behind something, you're a little bit more prone to actually act on it. But also, I want to try to shift the mindset and the mind frame around medications so that we can start to think of them as tools. And as you guys know, tools can be something that can be helpful. They can also be something that's harmful. So if you take something like a knife, for example, it can cut a slice of your most delicious sweet potato pie, or it can harm someone. So you really have to think about whether or not you are really taking charge of your medication and using this as something that is actually a tool for you rather than thinking about it as something that can be harmful. So go ahead, write in the chat, write in the comment box below if you're watching this on YouTube, and just let me know, what are your initial thoughts about medications? Do you think you have it all together? Let's just do a scale of 1 to 5. Do you feel like you feel really confident about your medications as a 5, or are you feeling, you know, not confident at all about your medications as a 1? All right. And so as those replies start to roll in, I will go ahead and get us started with this masterclass webinar. So if you have not met me before, my name is Dr. Wallace-Gay. I am a pharmacist. I specialize in primary care, and my platform and my company, is Bridge to Better Meds. I'm just getting out of clinic and talking to patients there as well. But my mantra here is that I want people to stop surviving on meds and start thriving with them. If you are someone who needs a medication for one reason or another, as a pharmacist, I'm someone who really wants you to understand that medication, because you are spending most of your time managing your own medical conditions. This is not something that you've got a physician or a pharmacist or a nurse following you around, managing your medications with you. So you really got to learn how to thrive on your medications. So a little bit more about who I am. My mission is to make meds make sense. And as I mentioned, I'm a pharmacist, I'm a professor, so I teach medical and pharmacy students. I'm a wife and I'm a mom of 2. They're a little bit bigger than that now, but I have a 3-year-old and a 1-year-old. And I grew up in a small rural town where even at the age of 16, I was the first Black person to work behind the counter of a small pharmacy in my small hometown. And from that moment, people trusted me with their health questions. I had no experience really at that point. I wasn't even a pharmacy technician. I was the person that was ringing people out. And so just my presence, people were proud of that. People wanted to ask questions. They wanted to approach the counter and ask more questions just because they saw a trusted face behind that counter. And so my hope is that I can be a trusted face for you. I can be someone who you feel comfortable asking questions to or taking advice from, so that you feel more empowered to ask questions to your healthcare provider. Again, as the community's pharmacist, I help people make sense of their meds so that they can feel confident, safe, and in control of their health. And just on a personal note, I am someone who has gone through pharmacy school, all of those things. But when I was on my own journey with medications, I haven't had to take a lot of medications in my life. I was just very fascinated with medications from things in my family, which I'll talk about in a minute. But I had my own journey with medications when I was faced with infertility. And I'm taking these meds, and it's like, this shot has to be taken at this time in this way. And it was just so particular. And it's a process that you don't want to mess up. Like, there's a lot of emotion on the line. There's a lot of physical stress on the line. There's a lot of finances on the line. So you don't want to mess it up. And I think, going through that complicated regimen, I already felt compassion and empathy for the patients that I serve, which is why I got into this area of pharmacy in the first place. But it just really heightened that in a way that, only going through something can heighten that sense. So again, my role is just to help you make sense of your medications. And I'll start with my very first patient who, I wasn't able to help make sense of his medications for him. And that's my dad. His name is Jerry Wallace. And my dad died of heart failure, or at least that is what the medical record says, that He died of decompensated heart failure back in 2008. So this was before I was in pharmacy school. I was still an undergraduate student at Tuskegee University. So shout out to the HBCUs out there. But I was still an undergraduate student at Tuskegee University. But I was one of the few people in my family who was health inclined in terms of like going to a into a health profession. And also as his only daughter, I was kind of one of the people that communicated with the people at the hospital. And he told everybody I wanted to go to pharmacy school. So, I got to step up and step into that role and take on some responsibility there. But, he was on a lot of medications as someone who was struggling with heart failure. And this is a man who didn't really trust the healthcare system that much. Felt like, they're just giving him medications just to give them to him. And shortly after his death, going through all of his things, we were looking at bottles and noticing that he really should not have this many pills left in this bottle if he's taking them correctly. Or he should have more of these pills if he's taking them correctly, just kind of getting things mixed up. And I can only imagine how overwhelming it was for someone who is, a very genius person in his own right. But when it comes to health and medications, like it has no age, it has no race, it has no education level. Many people get confused with how to manage their medications. And when you've got a complex regimen around high blood pressure, history of heart attacks, heart failure, and all the things that come along just with that alone, high cholesterol, smoking cessation, it can become overwhelming for someone who is not that well versed in the medication language. And so my goal with my father as a core foundation of this is to help you make sense of medications in a way that you feel confident enough to ask questions or at least understand how the meds are working so that you feel comfortable enough to take them. So I want to talk a little bit about mindset and I'm going to come back to mindset towards the end, but I start here because I believe that mindset really drives everything that we do. There's tons of literature out there that talks about just the power of mindset, gratitude, reflection, journaling, things like that. Even doing gratitude reflections for like 5 minutes a day enhances your positivity and enhances your mindset. And the brain is an elastic organ. It can change and grow. So we can actually, modify how we think and feel about things just by practicing that thing. And so what we know is that positive mindset leads to better health outcomes. And so I want you to be positive going into taking your medications and not really be in the mindset of like, oh, I got to take these drugs, or why are they giving me another medication? And instead try to understand the why behind it, because sometimes the why may mean that you actually don't need that medication because you're taking this other one correctly, or because you're doing other things from a lifestyle perspective that help promote your health without the medication. So I love this verse. My people are destroyed for lack of knowledge, Hosea 4:6. And I'm going to talk a minute about my AAA framework, awareness, access, and action. But we know that knowledge is power. And so just knowing something heightens your awareness around it, that just makes you feel some sense of responsibility that now you have this knowledge you need to do something with. And I mean, I know not everybody does, right? Not everybody does something with that information, with that access to information, but the hope is that you do. But the first step is the knowledge. Like you need to have the information in order to go forth and access the things that you need and take action on that. So let's talk about these 3 A's. And I came up with these 3 A's because I hear a lot in healthcare about access issues or access to care issues that people have. And those access to care issues 100% exist. But we don't talk enough about the awareness and the action piece. So I'm going to spend a little bit of time here. So I believe that you have to have awareness around something, you have to have access to do something about it, and you actually have to do something about it in order for you to have the most optimal care, most optimal management when it comes to your medications. So let's take this point by point. Let's just say you are unaware of something. So if we mark out awareness, you're unaware, but you actually do have access to the thing that you need. And if you were aware, you would take action on it. You would access it and take action on it, but you're unaware. We also have people that have access and that are taking action on things that are still unaware. So this is someone who may be taking medications incorrectly. because they have the medication, they're taking the medication, but they're unaware of certain risks or that there are certain behaviors that they're doing that are actually of detriment or are not allowing the medication to work appropriately. So you have to have the knowledge and awareness as a first step. Now, let's just say you don't have access. You have awareness about something, and if you had access to it, you would take action on it. And this is actually where a lot of people sit. They don't have access to pharmacies nearby. They don't have access to ask someone questions in the interim if they feel like they have questions about their medications or about their health. There's a barrier to be able to get in to talk to their physician or their healthcare providers. They may not have access because of financial issues as well. So access can look like a lot of different things, but the person is aware of what is going on, what they need, and they would take action on that if they had the access point. Now, let's just say you're someone who doesn't take action. So you can be aware of the issue. You can have access to it. You can have access to the thing that you need. However, you're just not taking action on that. So you may be someone who's aware of what's going on. You have access to it, but you're not doing the things that you're supposed to do in order to move forward, in order to shift the dial on whatever your issue or your concern is. And so you have to have awareness, you have to have access to what it is that you need, and you also need to be able to take action on that thing. So all three of these things are necessary and needed in order to move the dial forward when it comes to your medication management. And I want to be clear that I am not a pill pusher. I'm not someone who is pushing medications on people. I am someone who wants to make sure that people are using medications safely and appropriately. So if you do have to take a medication, are you doing that in the best way possible? Are you taking the medications that you need to? I just left clinic where I told a patient that I really think that she could come off of a medication. First, let's reduce the dose and then potentially come off of that medication if she's doing well without it for a few months. So there may be situations where you can come off medications, and I don't get paid anything by the drug company. So I'm not someone who feels like I need to be pushing medications for some type of agenda. So I just want to make that clear before moving forward, because just because I want to make sure that you use medications appropriately does not mean that I'm necessarily pushing the pills on individuals. So why are we here? We know that medications save lives. The medications that I talked about earlier with my dad, we know that medications in heart failure specifically have been shown to prolong life. They literally prolong survival. And so there are situations where people absolutely need medications, but many people feel overwhelmed by them. Either there's too many of them. Why am I on all these medications for this one thing? The doses seem too high or don't seem correct. They're having side effects that feel unmanageable. Just so many things that can feel overwhelming. They have to track other things associated with them. So that's something that, we have to keep in mind. But then medication literacy is the thing that's going to build confidence and safety. So that's where I bridge the gap between what the healthcare provider says and what the patient does at home. And what you do at home is that medication literacy piece. So making sure that you feel confident and safe in whatever it is that you're using. And so how confident are you about your meds right now? And so you can put in the chat or you can put in the comment box if you're on YouTube. How confident do you feel with your meds right now? If you feel really confident, thumbs up or give me a 5. If you don't feel confident at all, thumbs down or give me a 1. But how confident do you feel with the dosing of your medication, managing the side effects, telling a family member what medications you're on and why you're using them if they have to actually, turn up and help educate people about your medications if, Lord forbid, something happened to you. So some people are feeling pretty confident about their medication, so that's good. All right. So I want to just touch on the definition of medication literacy before I move forward. So the World Health Organization says that medication literacy is the ability to obtain, understand, and act on medication information. And I kind of expanded that definition a little bit because I do believe that, yes, you have to be able to obtain, understand, and act on information, but also it deals with the confidence and ability, as I mentioned earlier, to understand your meds clearly, communicate about them, and make safe decisions. So you're still having to obtain, understand, and act on that, but you need to have the confidence and also the appropriate ability to do all of those things, and also communicate about them as well. So the reality of the situation is that 6 in 10 adults take some type of prescription medication. 1 in 3 adults take 5 or more medications, specifically prescription medications, and we call that polypharmacy. And a statistic that I don't have on the screen is that over 50% of people that are taking medications are taking them incorrectly. And many of those people don't know that they're taking them incorrectly, but we get hospital visits, emergency room visits, even clinic visits where we are having conversations with people or they have some type of adverse effect that is directly linked to them taking the medication incorrectly. With that, we have 125,000 preventable deaths yearly just from incorrect use of medications. And that leads to a lot of money wasted from the healthcare system, from a patient's standpoint, from your pockets. You're taking things, you're taking your medication faithfully every single day, but you are taking it with another drug that it's interacting with. And so that medication really isn't doing much for you. Or you're taking it with a medication and there's an interaction and it's causing you to have a toxic level of one of the drugs because of that interaction. So a lot of different ways where people could be misusing medications, and we just need to get a little bit more education around that. So why do people struggle? Confusion with the names, confusion with instructions, also fear of side effects. I've had so many people that come in and they're like, my friend took this medication and they had this issue. Therefore, I don't want to take this medication. So just fear of side effects, or they've had a side effect with a different medication. And so they're fearful to take the next medication that we're recommending. Of course, cost barriers. I already talked about that. And oftentimes cost barriers are perceived because if someone has an issue with affordability, we can usually find something that works for them. If it's not covered on their insurance, most of the time we can find a patient assistance program or a coupon or something to help them get that medication, or we can find an alternative to that medication that is a bit more palatable when it comes to cost. Lack of communication is a big one. Just not getting the information in a way that makes sense for that person and not getting repeated information that's digestible. Because what we know based on the data is that about 24 hours after someone hears or receives instructions, they forget it. And also we know that people need to hear things 3 to 7 times, depending on the complexity of that information, before they remember it as well. So the lack of communication isn't just the communication in that moment, the words being said, but it's the continuity of that communication and how we're reinforcing things so that people, will be more prone to actually follow through on instructions. And then historical wounds cannot be understated or ignored, because we know that there are things that are just perpetuated through our life, our timelines that we do. We have mannerisms that are like our mom, and that's like her mom, and like her mom. And it's the same with certain things that come with the mindset. Why we do or don't do certain things, it's because we just grew up that way, or we grew up hearing that, and that's something that is embedded in us at this point. So the same thing is true when it comes to taking and managing medications, is that sometimes we just don't trust certain systems or don't do things a certain way, or do things a certain way because of historical references or historical wounds. So think of a time that you were unsure about a medication, and what did you do? And again, you can put this in the chat, or if you're on YouTube watching this, you can put this in the comment box. So think of a time that you were unsure about a medication, and what did you do? Did you ask questions? Did you look it up for yourself? Did you just go along with it and you're like, well, they told me to take it, so I'm going to take it and just follow the instructions because you're good at following instructions? So it's just something to internalize. What did you do? And my challenge is that I want to get you to a point where eventually you, immediately ask questions, or you go and start to do some information and some digging for yourself that will help you maybe ask better questions later. All right, so we're going to talk a little bit about how medications work. Just knowing the basics can have a big impact on how you approach medications. And so I want to talk about this just a little bit. Thank you, Laura, for that comment. I had someone the other day in a workshop that I did, and she said that she didn't understand the medication, and she immediately wrote her nurse actually in the portal. And I think that that's good. Like, if you have a good relationship where you can do that, And so I'm glad that you were able to do that as well. Some people don't have that. Other people don't even have a portal because they may live in a rural area. Their doctor's office doesn't have the technology to even have a portal to write in. So yeah, there are different barriers in place for that. But I'm glad when people feel empowered and feel like they understand and have a good relationship enough to reach out and ask questions. Okay, so let's talk about how medications work. I'm going to talk through 4 different ways of something called pharmacokinetics, which is a big word to just say what your body does to a drug. And this is important because if you're taking even one medication, but definitely if you're taking more than one medication, you want to make sure that you understand how it's getting into your body, how it's getting around, how it's getting broken down. It should be metabolism with an O, not an I, and then how it's getting out of your body. So let's just briefly talk through these. So absorption, how the medication is getting in. This is going to be influenced by a lot of different things. We know that medications can go in orally. We can do topical medications through creams, patches. We can do inhaled medications nasally. We can do under the tongue or in the cheek. So these are still kind of oral, but they're dissolving in the mouth so they don't have to worry about the stomach and the stomach acid. Medications can go vaginally or rectally. Medications can go through IV or IM through your muscle or sub-Q, which is under your skin. So medications have lots of ways to get into the body. One of the main ways medications get into the body is orally. So we swallow our medications. And this mechanism is influenced a lot by food. So some medications will say take it with food to help with that. Some medications will say take without food because that food will inhibit or slow it. Stomach acid may affect how quickly a medication is broken down. And if you're taking other medications, that may interfere with how quickly a medication can be broken down. So a really good example of this is something like iron and milk. It's supposed to be milk. So iron and milk can lead to poor absorption because you've got your iron molecule and the calcium in the milk, which bind together. And now all of a sudden you're not able to absorb the iron like you should. So if you have iron deficiency, then you think you're taking your iron every day and it's absorbing when really it's not. And the opposite of that is if you take iron with orange juice or with vitamin C, the absorption is catapulted. It's so much better. The vitamin C just really helps the iron to absorb into your system well. So I don't have any patients that I have on that are on iron that I don't strongly recommend that they take vitamin C along with that iron. So different things can affect the absorption in a good way or sometimes in a negative way. And then we think about distribution. So this is where the med travels. So once we swallow it, it goes into your blood, it goes into your gut, it gets absorbed, and then it gets absorbed into the bloodstream. And so now it has to actually travel through the bloodstream and get to wherever it's going to go in the body. So some medications are bound up in the blood by proteins. And if they're bound up by a protein, then they're just kind of going to kind of be stuck in the bloodstream for a while. And so some medications have what we call high protein binding, which means there's only a small percentage of that med that's actually free and able to travel and, get dropped off where it needs to get dropped off in the body. Some medications are fat loving and some are water loving. If they're fat loving, that means that they prefer to get out of the blood and into the tissues of the body. That can be the muscles, that can be the liver, the brain, wherever it needs to go. And the ones that are water loving are going to stay in the bloodstream for a little bit longer. And maybe we want them to stay there. It just depends on the purpose. And so this is going to kind of also explain why we have different doses for age and weight. Because specifically with weight, if you're someone who is heavier and you have more adipose tissue or more fat, then those medications that are fat loving are going to distribute into all the areas of the body that have fat really quickly. And you might need a higher dose in order for you to achieve the levels that you need to achieve, especially if you want it to stay in the blood. So distribution matters because we need to know where the drug is going and how quickly it's going to be able to go there based on the parameters of the drug. And then we've got metabolism. So metabolism is essentially how the drug is broken down to prepare it to be taken out of the body. And the liver is the main place where metabolism takes place. And so most of the time we're converting a drug from its active form into its inactive form. Every now and then we are converting drugs from an inactive form to an active form, which then gets reconverted into an inactive form. And then sometimes there are drugs that have active metabolites. So they come into the body active, they are metabolized by the liver, and then that metabolite is also active, and the body can still get rid of it. There are some things to watch out for with this, like grapefruit juice, for example. I feel like a really common example that people talk about is grapefruit juice with statin medications like atorvastatin or simvastatin, these drugs that are used for cholesterol management. And this is because grapefruit juice blocks the enzyme or the protein that actually breaks down the statin drug so that it can get removed from the body. So if you block the thing that's breaking down that drug, now all of a sudden you're taking that drug every day and you've got a lot of it built up in your system because you're not able to break it down. And that can lead to some toxic effects like muscle pain.
Okay.
And then finally, we've got excretion. So this is how the drug gets out of your body. The kidneys do most of the clearance. So most things get out of our body through our urine, but some things get out through sweat, through breast milk, through our bile and feces. And a lot of medications have to be adjusted, dose adjusted based on your kidney function. And that's like whether or not your body's able to clear things as quickly. So if you are someone who has lower kidney function or poor kidney function, and you're not clearing things out of your body as well, then we might need to lower the dose of your medication because we don't want that med to build up in your system and cause you to have, profound effects. Like if it's a blood pressure medication, we want it to go ahead and get out of your system so that you don't have your blood pressure be too low because now you have too much of that drug in your system. So excretion is how we get the drug out of the system, and most of the time that is through the kidneys. And then finally, pharmacodynamics. So pharmacokinetics, which I just talked about, all those areas, that is what your body does to the drug. It brings it in, it absorbs it, it distributes it, it breaks it down, and then it gets it out. Pharmacodynamics is the big word for what the drug does to your body. So the drug is going to bind to different receptors, which are just like on and off switches. But just know that most drugs bind to multiple receptors. So even if I'm giving you a drug for your asthma, for example, so we give drugs for asthma, which go and they work on receptors in the lungs. We want that. They work on what we call beta receptors in the lungs, but we also have beta receptors on the heart. So because most meds aren't specific enough to just work on the receptors we want them to work on, they have some specificity, but they will then go and work on other receptors that are similar to their target receptor and turn on or off those switches. So sometimes a medication that's meant to help, open up your lungs can stimulate the beta receptors on your heart as well and cause you to feel a little jittery or like you have a burst of energy. Which we don't want if you're someone who has some heart issues or some cardiovascular issues. So that in this case, we get the desired effect, but we also get side effects because the drug is acting in places that we didn't really want it to act. And we can only, try to work around that so much. So the goal here is balance. The goal is that we work more so to get the desired effects than we do with the side effects. But if the side effects are too profound, then we can reduce the dose or switch the patient to something else. So all this matters because timing is definitely going to affect outcomes. So I had a patient or a person at my church recently who was telling me she's on a medication, but her blood pressure was still really high in the morning. She couldn't figure it out. So I'm asking her a bunch of questions. One of her medications, I know that it's supposed to be dosed 3 times a day, 2 to 3 times a day, depending on what the dose is. And her dose was specifically supposed to be twice a day. And so I'm like, okay, and you're taking that one in the morning and at night? And she was like, well, no, I actually take them both in the morning because I want to just get them done and get them over with. And the reason why this is important is because this particular medication gets broken down and taken out of the body in a specific time frame, which is about 6 to 8 hours, which is why it has to be dosed twice a day or 3 times a day, depending on the dose. And so once that particular med, once it's out of your system, you tend to have what's called rebound effects. And so not only is the blood pressure going to be high because she hasn't taken the med, but it's going to rebound and be even higher because the body is kind of like a rubber band. It's like bouncing back and it's in shock. And so the particular medication is called hydralazine. And so again, she was supposed to be taking one in the morning and one at night, but she was taking them both in the morning. And then when she would wake up the next day, her blood pressure would be sky high. And she just could not figure it out. So timing is going to matter and it's going to affect the outcome. It also explains dose adjustment. So why do we adjust doses for renal function? And I already kind of talked about that. And this also helps prevent dangerous combos. So if I know that these two meds are going to interact because they are broken down by the same pathway, or because they both compete for the same receptors, then we know we can either avoid those two medications or dose them a little bit differently so that they don't have to compete, and one doesn't end up being at high levels or too low levels to treat whatever it is you have going on. All right, so just another reflection. And you just do this at home at some point. Write down the medication that you take or that you have ever taken. And are you 100% sure why you're on it? And then do you know what it's doing to your body? And I'll talk about this a little bit more in the next section when we get to the med mind map. But when I say, are you 100% sure why you're on it? I don't mean like I take this medication for my blood sugar. I mean, I take this medication for my blood sugar because it helps me use insulin better, or because it helps me pee out more sugar. So being very specific about why you're taking that medication, I think is important, because I hear time and time again of people being very concerned and very frustrated with being on multiple medications for the same condition and not quite understanding that we're tackling that from different vantage points, and we may not increase the dose of one medication before adding on another medication. So think about that. Are you sure why you're on it, and do you know what it's doing to your body? So with that in mind, the main thing I want to talk about tonight, and we've got about 20 minutes left, is the bridge framework that I came up with. And so this framework follows the letters of bridge, and the very first thing is to build a medication mind map, or a med mind map. The second step is to review your medications regularly, integrate them into your lifestyle, develop questions, guide your team, and empower action. And so I'm going to do a whole workshop, a full workshop on more of these steps soon. But the first step is to build a med mind map. And what I would love to do, and what I plan to do in the workshop, is to walk everyone through building a med map around one condition. But right now on the call, I'm going to show you how to do that with one condition, and you can kind of practice doing this at home. So building your med map is just turning a confusing pill list into a clear roadmap for better health. So a little bit of background: 40% of patients can't name all of their medications. And again, I'm just coming out of clinic and fresh off of a patient visit where I was asking her questions about her meds, and she was like, I know I have that on my, I just looked at that bottle and I know what it is. But in the appointment, she couldn't name them. And so it's really difficult to make adjustments based off that. And so this is kind of a plug to just take all of your medications to all of your appointments, or take your med list to all of your appointments. But one thing that you can do at home to help you visualize it, which helps with memory retention, is to create a med map, or just create a map in general. It really helps improve understanding and memory. So why do med mind maps matter? So I call mine the med mind map, but this idea of concept mapping or mind mapping is not something that I made up. Concept mapping is something that has been done time and time again. We have our students do it all the time to help understand medications. And so I just want to bring this to the patient side of things. So 50% of people don't take their meds as prescribed. I already mentioned that earlier. And people who use concept maps achieve higher understanding of information. And this is all backed by science and data. So we know that people understand their meds better when they actually map out and can conceptually see what medication is doing what are the side effects, what are the additional benefits of that med, and what are the overall goals. All right, so let's go ahead with the building of a mind map. And so by the end, I hope that you walk away with your own med mind map. And if you're home, you can do this now, or just kind of take a nugget if you're not in a position to write down anything, so that you can come back to this video and do this later. So the first step that we're going to do is pick a disease state. And then we're going to think about grouping those things into buckets. We're going to add your meds, connect your goals, think about any red flags, and then also think through how we can ask better questions. And if you want the guide that I built for this, you can use that, scan that QR code, and that will take you straight to the Med Mind Map guide that you can download. And it has all of these steps in there and a little bit more information as well. All right, so first pick a disease state. So let's just say you've got someone or you yourself or someone that you're caring for has diabetes, hypertension, and mood disorder, depression. So we're going to start with one. And I think here we're going to start with hypertension. So you put hypertension in the middle. And really we take a step back and do like a 10,000 foot view on what are some ways that we can actually control your blood pressure. So we can slow your heart rate so that you don't have to work as hard. Your body doesn't have to work as hard in order to get blood throughout the body. We can reduce some of the fluid so that there's less pressure in your blood vessels. And we can also relax the blood vessels so that they're not so constricted. We just relax them a little bit. And so these are some of the main ways that we can do that. We also have some direct vasodilators or direct dilators of the vessels, but that still falls under relaxing blood vessels. So these are kind of the three big buckets. So I would take a step back with you and look at, okay, if we're treating this, how can we even target this in the first place? Then we look at your actual medications. So to start, all right, we've got hypertension here. And you may decide that you want to put hypertension at the top and just kind of do more of an algorithm going down, which is kind of what I do when I do the workshops for this. But here I just have it as more of a circle representation. So hypertension in the middle, and then what medications you're on. So maybe you're on a diuretic, something like HCTZ. Maybe you're on an ACE inhibitor or an ARB, something like lisinopril. Maybe you're on a beta blocker, something like metoprolol. So first, you would think about each of these medications and what's the purpose for it. And we'll look a little bit more closely at that on the next slide, a closer look. Then what are some ADRs? What are some side effects that you would expect? So ADRs is adverse reactions. What are some side effects that you would expect? So with diuretics like HCTZ, I might expect my calcium levels to go up or my sodium levels to go down. So this is something that, are you using a good reference to look at these things? Are you working with your pharmacist or your provider to talk about these things so that you know what you should expect from this medication in terms of side effects so that you're not thrown off guard if you happen to have something, or so that you know when a little bit of a bump is okay and when a big side effect is actually a big deal that you need to talk to someone about. Also, we want to put on here dose and timing. So what dose of each medication are you taking and when do you take it? Is it once a day? Is it twice a day? Are you able to take certain medications together or do you need to spread them out? So these are all things that you would insert underneath each of these medications, as well as the route, which all of these are taken by mouth. And then you would put next to it or next to that medication who your prescriber is or who your point person is for that. And this is really important for me being in the clinical setting when people come in and they have 3 or 4 different physicians. And again, I just talked to somebody about this the other day. She was walking me through her med list, and there was one medication I was like, she told me she was seeing a neurologist, she told me she was seeing an endocrinologist, and she told me she had a primary care provider. But looking at her med list, I was like, do you also see a cardiologist? And she was like, oh yeah, I forgot to tell you, I also see a cardiologist. And I just picked that up just based on the prescribing pattern of what medication she was on. But that's so important because now I'm like, okay, so you need to go home and map out your meds in a different way. You need to first put a list of all of your meds and put the providers or the physicians up top and who's prescribing what. Like she needed to be clear on who was prescribing what. And then we could sit down together and figure out, okay, where are the overlaps in terms of like these 2 meds from my primary care doctor and my cardiologist kind of do the same thing. Do they even know, do each of them know that I'm on the drug that the other person has given me? And so she and I are going to walk through her med map in a slightly different way because of that. So just kind of taking it even a step back. So making sure you know who the physician is that actually prescribed the medication so that if you do have questions, you can actually address that person. And so that all of your other providers know as well, because some systems speak to each other. Everybody works in the same system, but other systems do not. And your physician, your cardiologist can't see what your primary care doctor is prescribing you. All right, then we need to connect the goals. So for blood pressure, maybe your goal is less than 130/80. Maybe your physician is aiming for a slightly higher goal for you. So, but you need to know what that is. What does that look like on a day-to-day basis? When you wake up in the morning, when you go to bed at night, are those goals different? How often should you be checking your blood pressure at home? So all that information needs to also go on your map. Um, what are your goals? All right, and then you need to be able to, oh, and let me back up one step. So with each of the medications, you can kind of see here. So for diuretics, for HCTZ, I just put removes water. So this is what I mean by taking it a step further. We know that all of these medications are for your hypertension, but do you know exactly what they're doing? So the HCTZ removes water. The ACE inhibitor, which is lisinopril, relaxes your blood vessels, and the beta blockers slow the heart rate. And if you're someone who wants to take it even a step further, we can have that conversation. I can tell you, how the lisinopril is relaxing your blood vessels, how the HCTZ is removing water, or how the metoprolol is slowing the heart rate. But I think as a start, these are good steps so that it's going beyond just treating my hypertension. What is it actually doing for me? How is it helping me? And why am I on 3 different meds for this one condition? And then spotting the red flags. So some of these things you need to be able to have your labs done to see, like, is my potassium going up or down? Is my sodium going up or down? Which medications might cause this? So I didn't link this to the meds on the prior slide, but this is something that we will walk through during the workshop is, do you know what the most common side effects are or outputs are for these medications? And do you know maybe one or two really rare but really important side effects that you need to be aware of? Is this medication something that can cause dehydration, like the diuretic, or dizziness, like any of them that are lowering your blood pressure? So again, things to think about, to spot when it comes to side effects. And then finally, you got to be able to ask better questions when you go to the doctor, because if you don't ask the right questions, you're not going to get the right answer. So why this medication is a good question to ask. What is the goal? What are we aiming for here? Because your goal may be different than your cousin's goal. Even though y'all both have the same medical condition, you might have other underlying things going on that don't apply to the other person. So your goals, even for the same condition, might be slightly different. What are the risks and side effects? How will we know if it's actually working? So what are some things that you can look at home or follow up on during your appointment so that you know it's actually working? And I'm not going to get into the R, which is reviewing regularly, but you have to go to every appointment and also at home by yourself and look at your med list often and say, do I still need this medication? Am I still the same person that I was 6 months ago, a year ago? Sometimes the answer is no. You don't still need, 2 medications that you had to have right after you had your stroke. Now we can bump that down to just you being on one of those medications. But sometimes there's something called clinical inertia that happens where we just get stagnant and we address the problem that's in front of us at each visit rather than reaching back and addressing things that had already been talked about before. And so then nothing happens and the patient just stays on the same med forever and ever and ever without any reassessment of it. So again, the right questions lead to better answers and, of course, better health. So you have to ask the right questions. So I already mentioned, take your med map to every appointment, take your med bottles to every appointment if you can. Use it to spark better conversations, review it regularly. And my big thing is that healthcare is a business, but you are the CEO. So you got to show up and act like the CEO of your health that you are, as the patient in the center of this patient-centered care model that we practice. All right. And the very last point that we are going to hit is mindset. And I talked a little bit on mindset right at the beginning, but people think about mindset as this really fluffy thing, but we know that positive beliefs improve outcomes. This is medical outcomes. So if you have positive beliefs, it just helps you at baseline. And I'm not saying that it's going to be the thing that cures your hypertension, but just having positive beliefs about your process, being willing to learn, all of that is helpful. And there was a study that was done by Stanford University, and they looked at, I think it was 7th graders through 10th graders, young kids, and it was all about math. And so the kids who believed and enjoyed math asked more questions. They looked at their brains when they were solving math problems, and the way that their brains lit up on the scan was a lot different than those students who self-reported that they weren't good at math, that they didn't like math. Their brains were a lot less sparked during completing these math assignments. And so even the kids that liked math but weren't good at it had sparks when it came to completing the assignment. And those students tend to do well in the long run, according to the study, than even the students who were fairly good at math but didn't like it. So it just goes back to this positive belief and positive outcome on things. And then we already know that fear and stress can worsen illness. Like we talk about that all the time of just like trying not to stress yourself out because it's going to only make the problem worse. So old thinking versus new thinking. I challenge people to say things like, go from saying things like, I'll be stuck on these meds to meds are just a stepping stone. And I actually will tell patients all the time, like, let's just start you on something while you're working on yourself. And I frame it in that way because I want them to walk out thinking, I am still working on myself. This is just a stepping stone in the process. And my genuine hope in those situations is that they can come off of medications. Now, I don't say that in situations where the medication is something that's going to be necessary indefinitely. I say that in situations where the person can actually do things from a lifestyle standpoint that could reshape their outcome when it comes to that health condition. Let's reframe from there are too many side effects to we can adjust the dose, we can adjust the medication. Let me figure out what's going on. Let me write down my side effects and report those so that my providers have more information to be able to adjust my meds. And let's also go from my doctor knows best to we decide together. Because your doctor, your pharmacist, your nurse, these are people that are your advisors. They're technically people that you hire to give you advice on how to manage your life. But when you go home, you decide whether or not you're going to take the medication. Now, ideally, you would want to decide together during that appointment or during that education session that, this is the best step for you moving forward based on the advice of your consulting team. But at the end of the day, it's really your decision. So you have to be able to feel like you've had a good say in that process in order to move forward and, do the right things. So as I mentioned, healthcare is a business, but don't get it twisted. You are the CEO. You hire the team. You decide who you want your providers to be. You can switch providers at any time. You can go to a different pharmacy at any time. You approve the approach, even though we use evidence and we try to tell you what is the best evidence based on the information that we have. You have to approve it and decide to do it. You have to act on it. So the awareness, the access, and the action. You set the goals. So again, we advise you on the goals, but you may say like, right now my goal is to get to this, and then my goal is to get to this. And then it's our job to work with you to achieve those goals. And then, of course, you implement the plan. So you go home and you decide whether or not you're actually going to follow through with the plan that has been hopefully decided on together. So one final reflection is to just rewrite or think about one limiting belief that you have when it comes to medications. What's something that you have thought or heard somebody say that feels like maybe a negative or a limiting belief? And how can you reframe that into an empowering statement? So something like, I'm sick of all these meds, or I don't know why I have to take all these meds. How can you reframe that into something that's more empowering and that gives you more of a, I guess, more of a mindset to act on or to change your outlook on that statement? So, just to close, a recap on the bridge method. The B is building your med map, and I've kind of walked you through what that looks like. But again, coming to the workshop is going to be a lot more impactful. So please come to the workshop, let people know about it. But we're going to build a med map together. So everybody's going to have their own whiteboard or white paper. We're going to pick one disease state or one medical condition, maybe two if you only have like a couple of small things going on. And then we're going to build that out. What medications are you on? What are the goals? How do these medications work? And that's the point of the workshop, is to actually work throughout. But the R here is to review regularly. The I is to integrate these meds into your lifestyle. The D is to develop questions. The G is to guide your team. And the E is to empower action. And so we'll also have time to work through the rest of these pieces of the framework just briefly as well. And so hopefully something surprised you. Hopefully you learned something. And I put the quote here from Romans 12:2, and do not be conformed to this world, but be transformed by the renewing of your mind, that you may prove what is good and acceptable and perfect will of God. So thinking about the transformation here of your mind, so that you can go on to do the things that are good and acceptable and the perfect will of God. So with that being said, thank you for being a part of this medication mastermind. Any feedback will be appreciated. And I am having the workshop in Tyler, Texas, coming up soon. So consider coming, invite your family and friends. If you're watching this on YouTube, again, just go ahead and scan this QR code, or I'll put the link to the feedback in the chat below. And I'll also drop the link to registering for the actual workshop. And this is just information. So the workshop is at Smith County Clubhouse on Monday, 12/4/2025, and it is from 12 to 1:30 p.m. So it's around lunchtime. We should have some refreshments available, but come up and bring all your meds, bring your med list, bring your bag, your little baggie of medications, so that we can be prepared to have the most accurate information possible as we get ready to build your med map and hopefully bridge you to better meds. Thank you very much. That will conclude the workshop for this evening. Please subscribe to my YouTube channel. You can watch all the videos there. And also you can join the private Facebook group on Facebook, which is just titled Bridge to Better Meds, where I post questions, polls, as well as educational information just about a bunch of different med-related things. And also I accept direct messages from the private community about whatever questions they have about any of their medication. So hopefully I'll see you over on YouTube, or I'll see you on Facebook. Thank you. And I hope you have a good night.